Thanks so much, everyone. Well, first of all, thank you all for joining today, and a special thanks to NASCA for providing this forum to have this great conversation. And especially delighted to be joined by three exceptional public servants from Tennessee, Hawaii, and Wyoming, who we've had the pleasure of working with at Amazon Business. So our panelists today are Melissa Huck, with Chief of Staff with Department of Military, Tennessee Emergency Management Agency, and was reading Melissa's bio, and she's responded to more than 36 disasters. So very curious how this one ranks. We're also joined by Bonnie Kahukui, Assistant Administrator, Procurement Office, State of Hawaii, who brings more than 20 years experience in state government. And finally, Dirk Dykestal, who's a JD, and he serves as Section Chief with Health Readiness and Response in Wyoming Department of Health, who brings his private sector experience to the job. And what I love about this panel is that, you know, they're not only all on the front lines of responding to COVID, but with their focus on emergency management and procurement and health, I think we're going to get a nice 360 view of what it means in the times of COVID to be innovative in order to keep pace with the urgent and important needs of our communities. And the word innovation, which is the focus of our discussion today in the times of COVID, the word innovation is often associated just with technology. You know, people think about building new products or new features, but innovation is a lot more than that. And it can simply be a completely new way of doing things, new processes. And for government, it could mean radically shortening the time to procure, which I know has occurred during COVID, by streamlining previously lengthy processes, or it could be turning to other channels like online marketplaces to help source and deliver scarce products. And what we're hoping to hear from our panel today is more about, you know, what are you doing differently to be innovative in the time of COVID? And also curious whether you think that may be the new normal long term, not just because we think COVID's going to be around forever, but have some of these innovations proven to be so effective that you're going to want to keep it long term? And we also, of course, want to hear about some of the challenges and successes in innovating. And I'd say my observation from Amazon Business is that suppliers and governments have come together in a really nice way, in a more very strategic and I think innovative way to help respond to COVID. And, you know, Amazon Business has grappled with, I think, many of the same challenges and questions as our government customers. So, you know, how do we ensure our workforce remains healthy? How do we ensure the continuity of operations? And then how do we continue to provide a high level of service to our customers, in your case, the citizens? And, you know, these are certainly challenging in any environment, but especially so during COVID. As I was saying, one of the things that we grappled with, I think governments grappled with, was, you know, how you prioritize customers. And we developed what I thought was a really sound methodology we would apply to customers, and thinking through, are they in a hotspot? Are they on the front line? Are they a state government that's coordinating on behalf of many entities? But what we realized in execution was that methodology went right out the door because it wasn't scalable. We couldn't apply this methodology customer by customer. You know, how do you define a hotspot? Is it current or future? Is it per capita or total? And so we ended up really simplifying the process to identify segments of the population we knew were frontline responders, like hospitals, state governments, and then simply whitelisting them, and they came into the store and it was first come, first serve. And we started small, you know, giving access to a small number of organizations, and then scaled from there. So in the end, you know, we were able to deliver, I think, 200 million products to frontline responders, but we're still grappling with how we execute on this. We're still finding our delivery isn't perfect, our technology is not perfect, and we're learning as we go. So we're really eager to hear from our 3 state customers just how we can learn from you and the challenges that you've overcome or are overcoming. So I'm going to turn it over to my colleague, Andy Krasmerizik, to moderate our panel, and hopefully you can hear Andy much better than me. Thanks, Andy.
All right, thanks, Ann. Yeah, actually, Ann and I were in the trenches, literally meeting almost every day, sometimes on weekends, from about mid to late March through mid-April, maybe late April, just trying to, through a daily stand-up, meet with other leaders and other key stakeholders across Amazon Business to sort of grapple with the challenge that we had to face with COVID. And so really what I asked our state colleagues, our state partners to do, first of all, I want to say thank you myself to Bonnie, to Melissa, and to Dirk, both for their partnership, but also for making some time today to share their insights with their colleagues across the country. I asked them to share their COVID evolution story. So when did you first realize you had a problem? You know, sort of America, we got a problem. Or whatever your state, would be, you sort of, okay, we have to address this. And then since you're all involved with procurement, what were some of your biggest supply chain challenges early on in procuring COVID supplies? And then what were your most reliable sources? Could include Amazon, could include other vendors, of course, but just wanted to have that as your frame. We've asked each of them to share sort of, 3 to 5 minutes of that COVID evolution story. And so we'll begin with Bonnie. Bonnie, are you with us and ready to share? Hi, Bonnie.
Just need to unmute myself here. Good morning and aloha, everyone. I know it's afternoon for most of you. I've been asked to share a little bit of Hawaii's challenges during this COVID pandemic. Like other states, we face shortages in almost every area. But unlike other states, we are in a unique situation. We're in the middle of the Pacific Ocean.
I don't think you probably don't either.
Spread across 8 islands, 2,500 miles from the nearest landmass. So,
hey, Bonnie, I want you to be interrupted. Ace, you were on mute, so Bonnie, go ahead.
Oh, okay. So being in the middle Pacific Ocean, almost everything we need has to come by ocean liner or has to be flown in. We don't have the luxury of going to our next neighboring state and tapping into their resources. So when we were faced with this emergency, we knew that we were in for a lot of challenges. We were informed, we heard the stories going on, but Hawaii was kind of isolated. We didn't have a lot of cases for a long time. It was the 1s and 2s, but on March 15th, we were given a stay-at-home order, and we were all home by March 16th. So it was a really fast and quick turnaround time. We knew that we were going to be faced with long lead times and exorbitant shipping charges. In some cases, whatever we were buying, half of that was shipping charges. So it was it was crazy. Not only did Hawaii face shipping challenges, but as one of the smaller states in terms of population, we couldn't compete with the larger states. Frequently, we found ourselves outbid, not only in price, but in quantity. We couldn't compete with the Texas and the Californias. Our vendors told us, oh, Texas had a much larger order, so we're gonna fulfill those first. So what we did is, our staff, we basically hounded our vendors to every day, multiple times a day. We need this, please provide whatever you can for us. So we ended up with, third-party vendors. Some of them we weren't too sure about. We didn't have a lot of experience with, but we didn't have a lot of choices. So we went to smaller vendors who could probably retool to make some of these PPEs. We had our staff calling fashion houses here in Hawaii, fabric distributors, asking them, can you make these cloth masks, community masks for not only our staff, but for the public? We heard from the University of Hawaii that they had a 3D printer, or someone had a 3D printer, so could you make masks or face shields? That wasn't successful. They weren't able to do that. But we tried everywhere. We had a blueprint company who's making face shields. We went to our smaller distilleries, asking them if they could make hand sanitizers. Some of them could, some of them could not. But we just called around and did everything. And we were very surprised that everyone stepped up to the plate. I mean, we had local church groups making masks. Unfortunately, it wasn't on the big scale that we needed, but at least they were able to provide for our local communities. It wasn't only PPEs. Everyone is now looking for plexiglass, for shields for their offices. We just had someone come in yesterday to put some shields up, and it had been on order for almost 4 weeks. Everybody's looking for that. One of our staff members, who's kind of a handyman, went down to our local hardware store and bought plexiglass, and he made it himself, and it actually saved us a whole lot of money too. So we're being very innovative. We're calling around, asking everyone, what can you do? What can you supply? We even called other states. Can you give us some help? Can you give us some resources? We relied on our organization, the National Association of State Procurement Officials, and they were able to get some information, put up on their website some resources, which was very helpful. We weren't familiar on specifications on masks. I never knew there were so many different kinds of masks, medical grade masks, community masks. I mean, N95s, KN95, we had no idea. So we had to rely on their experts. Our Department of Health had some information, but they were busy doing other things as well. So we relied on NASFO to get some of this information for us. What kind of disinfectants do we use? What are specifications for body bags? I mean, as gruesome as that sounded, we had no idea. So we reached out to other states and anybody that could, provide any information. What kind of resources? Who do we go to? Who even makes these kinds of things? So it was a real steep learning curve. And fortunately and unfortunately, we have to learn it quickly. And so we're able to use this as we go forward. To make matters worse, there was rumors going around that Hawaii was going to have a shipping disruption in our container shipping. So not only now were we afraid of getting shipping in, our local residents were concerned about food shortages. So you go to Costco, they had no toilet paper, they had no hand sanitizers, they had no, the Lysol wipes. There were huge lines everywhere in a time where we were telling everyone to social distance. We were able to, with the help of the communities, squelch that rumor. So things kind of backed off, because we're so reliant on everything from food and gas, and there are long lines at gas stations. It was crazy. In addition to that, once we started ordering all of this equipment and all these PPEs, where were we going to put them? We could store some in some of our warehouses, but we weren't prepared for, dozens of pallets of face masks and ventilators. We kind of relied on our National Guard to help protect some of these shipments until we could get one of our local warehousing companies up and ready and set to not only to accept, count, receive, and then turn around and distribute that. As far as resources, we've had most successes with the Grangers. We've had success with our body armor outlet, who normally you buy, tactical equipment from, but they were able to step up to the plate. And of course, Amazon. Amazon is our only online marketplace, but they've been proved to be very successful. Originally, we did not make the COVID supplies accessible to all our staff or all our jurisdictions statewide. We didn't want to be able to compete against ourselves. So we concentrated only to our leads who are working with the Hawaii Emergency Management Association agency. But eventually, as things kind of trickled back or wasn't such a great rush, we did open that up, and we did find our other agencies able to buy in smaller quantities. Unfortunately, the state of Hawaii now is in a surge. We used to think 20 cases was bad. Now we're up to, I think the last count was almost 200. And probably in some cases, that's still small numbers, but for us, that represents a huge surge. And we're looking at ways of now stepping back. Do we need to do shutdowns again? Do we need to do more things? But the governor and all our state leaders are trying to be innovative, trying to do whatever they can to open the state up. As you probably know, tourism is one of our #1 industries. And without tourism, we are facing a lot of challenges. So we're trying to be innovative, trying to do as much as we can to protect everyone, still provide the social distancing, and keep COVID from spreading. Andy, is there any questions that anyone might have for Hawaii?
Well, I think what we'll do, Bonnie, is, by the way, thank you. That was wonderful. And what I want to say is, out of everything you said, I really, there was a moment where you talked about how churches were stepping up and the community was bonding together and people were doing whatever it took. And I think at a time when we maybe otherwise feel that we're very divided, that gave me a glimmer of hope that there was a united effort. It made me feel like that's when we've been our best as Americans, and we've bonded together against a common threat, and that really was inspiring to me, Bonnie. So thank you. What I'd like to do now is move to Melissa and hear Melissa's COVID evolution story. Then we'll move to Dirk, and then we'll open it up to questions. But thank you, Bonnie. Melissa, are you with us?
Yes, Sandy. And thank you for this opportunity today to speak. Our hearing Bonnie speak, a lot of similar situations here in Tennessee. So we realized right off the bat, day one, our first phone call to vendors, that we had supply chain issues. Our issues were not only were we competing within our state, but that we were also competing with our sister states, with other states in the country, and then worldwide. A few of our concerns were shipping, as Bonnie mentioned. Getting products from overseas were a challenge. We in Tennessee were able to work long-term deals that are now becoming fruitful with shipping via sea instead of flight, which was an interesting concept that we had not ventured into. One of the other challenges that we ran into was dealing with new companies. I'm sure other states dealt with this. There were innovators and entrepreneurs standing up companies with PPE items left and right. And there was struggle dealing with those companies as they were not set up, whether it be financially or even with some integrity that put the state in position of requests to upfront money or to wire money so that they could use that floating of money to be able to make the products. So we ran into several issues where we would spend a plethora of time investigating companies. Some of those did become fruitful. Some of those, unfortunately, took time away from our team and staff to focus on other companies or innovative ideas to be able to move forward. A few of the other challenges that we found were, as Bonnie also mentioned, was the quality and grade of material or supplies that we were getting. One of the innovative things that we also did is we partnered with higher education. We partnered with our Department of Corrections to make face shields, to make gowns, items that were not able to be secured and found close by or in a time frame that our public safety partners needed. A couple of the companies that we did strike deals with and had great partnerships, one was with Amazon. Granger was another great company. Safeware, Fastenal have proven to be kind of our partners we've locked arms with. We had great communication with Amazon during this event as they developed the COVID-19 online platform to be able to have an open line with the team there to develop what the need was on a user end, how to integrate and develop that to meet the needs of public safety across not just our state, but across the nation was something that we enjoy doing and continue to work with them as we move through this event. In regards to historical and innovative events here, one of the things Tennessee did, we termed the pivot as our kind of our term for this event, is we pivoted from dealing with a one-on-one relationship with our counties to centralizing all purchasing for all 95 counties and jurisdictions, all of our public safety departments at the state level. So we partnered with a company here, Journeys, who does shoes. Some of you may be familiar with that in the Southeast. Was able to go in with their warehouse space and basically stand up a distribution center, which for Tennessee was historic. Through that, we developed online ordering processes for our communities. We are now adding K through 12, our public school system and non-public school system, partnering with them to develop teacher kits that they can order, that we can supply. And what we have found through that, a challenge, instead of one individual entity ordering as a state, buying in bulk and whole, partnering with the Amazons, with the Safeware and Fastenal, we're able to develop streamlined processes, ordering processes, and fulfill their needs in a more quicker and a dynamic process than each individual entity working on their own. And I will close with this. We feel like Tennessee, we had a heads up on most states. Some of you may remember Tennessee had just been through devastating tornadoes 72 hours before our first COVID case. So our teams, our policy statute waivers for states of emergency were already in place that allowed us to transition and pivot to the COVID response quickly. And we think that that was a huge lead for us to get ahead of that PPE supply chain at the beginning. So Andy, that's kind of a brief overview from Tennessee. I'll turn it back to you.
Great, thanks, Melissa. And one thing I'll say is early on, I think that's what some other states were telling us in terms of the multi-emergency situation. They were saying, you know, this says, what did you say? You're in like day 157 of this. I mean, it was interesting that you had a count. You know the exact number of days, and you knew that relative to prior emergencies. And what was the longest prior emergency? It was something like in the 90s. And so you have this baseline emergency now that's ongoing. We don't know when it's going to end, but other states are grappling with, well, what do we do now if a hurricane comes or tornado? And so I really appreciated your perspective and sharing that you were kind of ready for that. I think other states would probably want to follow up with you if they could and find out how you're applying any lessons learned there. So thank you, Melissa. And so finally, we have Dirk Dykstal from Wyoming. Been a great partner working with a few members of my team. And so Dirk, floor is yours.
Hi, thanks. I just want to thank Andy and Ann and then NASCA for this opportunity to speak. What I would say though is I knew I was in trouble when I took this position a little bit over a year ago. Prior to that, I was mostly a private practice attorney, and my wife was like, man, you're going to be able to oversee a decent portion of the Department of Health. What a cool job. And I was like, yeah, that's probably true so long as a pandemic doesn't happen. And here we are. But what I would say is that, you know, we kind of knew early on that Wyoming was going to be a little bit of a struggle and would have some issues. Some of the underlying planning assumptions from the public health side of things is that Wyoming is probably one of the more frontier states, if not one of the more rural states in the United States. We have a population of about 500,000, so that presents some unique challenges, but also some unique opportunities. You can go from one city to the next and not see a person, probably see more cows than you would people for the next 40 minutes. So there's just some very unique issues that we had from our state. So listening to both Bonnie and Lisa, there's definitely a lot of similarities, and probably Hawaii and Wyoming both feel pretty isolated. So we knew there was going to be a lot of challenges there. Back as early as late January, that we were submitting orders through a lot of our traditional partners. And what we ended up finding is that a lot of those started getting back ordered and then back ordered or canceled. And a lot of that is because, our orders were smaller, and they just, the traditional partners that we worked with no longer could fulfill those orders. We're getting UTF'd, or, various other reasons came through. So what I would say, what did work and didn't work was fast deals just didn't work. We couldn't go with our traditional partners. It just wasn't coming into the state. Like Melissa said, I probably would get 40 or 50 emails in a single morning from not only new opportunists to the governor's office, adding on, I have this person who knows somebody, or those type of opportunities that came in, and vetting those were very difficult. So some of the success that we had early on was as early March, we moved to a unified command structure, and the state of Wyoming's never done that before. Usually for a lot of these response capabilities, it's usually head by a certain agency, but we decided to move for a unified approach where the Office of Homeland Security and a large portion of the Department of Health that I oversee, basically were co-located in the basement of Homeland Security for a while in the EOC. And that helped just streamline all the communication, all the information that came in, all the various types of opportunities that came in through the SNS, through FEMA, and then all the various different sorts. One thing we have an issue here in Wyoming is just personnel. I mean, right now we're looking at budget reductions that are significant, and at the same time, an influx of CARES Act dollars that this state has never really seen before. So it's a very odd place to be in right now. But personnel, as I heard previous speakers in the previous group said, early on there was a freeze of hires, and that happened to us very early on as well. So by moving to a unified command group, we were able to dedicate additional personnel that we wouldn't have normally on hand for any response. So we got people in the room that knew the specifications early, very, very early in the process. So saying, what is exact specification we would need for this type of individual that we're trying to help out. Talked about the underlying planning assumptions that we had earlier. Public health thought we would only be helping public health responders, not supplying the whole supply chain for the state of Wyoming for PPE. That was one of the bigger issues we had too. So getting someone in there early, saying this is exactly the types of products you need was huge. Also having a dedicated team of individuals internally that was constantly checking on prices, demand, and just vetting all of these different offers that were coming in helped us start really creating, okay, what is a decent deal and what's not, what's a fair price, what's not. So all those different type of processes that we set up early really, really paid off. One of the other things that was huge was we didn't make a deal with anybody until we got a sample. Wyoming we knew we weren't going to get those fast deals. We just knew that this problem wasn't going to be solved in 2 weeks. We weren't getting to fulfill the demand in 2 weeks. So we started working towards more long-term deals. I think the pitch that I had on the phone most of the time when I was doing this was, look, I don't need this problem solved today, tomorrow, or in 2 weeks, but if we can strike something a month out, 2 months out, that's when we got successful. And that's when we really started turning the curve on the demand and being able to actually supply people statewide. So those were really two big things. And then the final thing that I'd probably end on is the resources from our just neighboring people in similar situations was huge. Just reaching out to neighboring states saying, hey, have you used this person? Have you used this source? What are you guys doing? Just even taking 2 seconds just to make that call. It was very surprising how someone in a similar position that I frankly met back in October in one conference was willing to get on the phone at 8 o'clock at night and chat with me for half an hour of what they were doing, and that was successful. Just sharing one quick story that really illustrates how this panned out. We had one of those deals that Melissa talked about where very promising on the surface, sounded like it was a vetted partner, came in, promising kind of the world to us. And we did some due diligence and asked for samples for the different types of products that they were going to supply us with. And it wasn't until I called one of our counterparts down in Alabama and never met the guy before, but just talked to him and said, hey, have you ever dealt with them? They, you know, the order form they gave us actually still had Alabama on there before they changed the offer to us. And he said, oh yeah, we looked at them and definitely don't go with them. And we were able to not move forward with that deal, luckily. And another state got trapped into that, and it was kind of a big deal at the time. So just what I would say is reliance on partners and just being able to get on the phone and have a conversation with someone else in another state that's in a similar situation was huge.
Excellent. Thank you so much, Dirk. Actually, because you and Bonnie both said that, I didn't have this in one of our original questions, so sorry if I'm dropping this on you all, spur of the moment. But Bonnie, you said, and I like that you shared, Dirk, a specific story about reaching out to Alabama. Bonnie, you said you reached out to other state partners. Do you have a more specific story that you'd be willing to share as an example of how you cooperated with other state counterparts?
Well, I know that we did reach out to actually Washington, DC. They were going to put out a solicitation for, I don't recall exactly which PPE, or maybe it was all of them. Unfortunately, that didn't work because they wanted a commitment of, I think it was like 500,000 of something, and we weren't able to commit that far in advance. But at least we got a good idea of, there's the specifications, what vendors were out there that could provide these things, and tap into them for the smaller quantities, or get them on board so that we can have future conversations with them.
Great, thanks, Bonnie. Melissa, same question for you.
Absolutely. We partnered with our sister states to look at going in together for larger purchasing. Unfortunately, that was not fruitful, but it was an option that we looked at to collaborate together with vendors for larger purchases.
Lisa, can I stay with you? Since one of the questions, it's from Jamie at NASCA. She says it's fascinating about how you vet new partners. Same was true for Dirk. She said interesting from Tennessee about how so many of the new vendors took more time. Is there anything you learned from vetting new vendors that you would apply going forward? Is there some way that you think you would maybe expedite that? And I'm thinking specifically in the direction of how do you get your economies going again by buying from maybe local, or Tennessee or Wyoming or Hawaii-based sellers to the degree that that's possible?
Yes, so we found that it took us about a month or so. What we did is we set up a unique email address because as Dirk mentioned, we were inundated of friends of a friends, or they had connections, and email boxes were getting overridden with new contacts that you could not get to the meat of what we needed to do. So we did auto reply, set up an email box, and we actually partnered with what is called Launch TN, which is an entrepreneurial program within Tennessee. Unfortunately, it took us 45 days to get our hands around that. I wish we would have started it earlier, but they actually were able to set up a form stack in collaboration with our agency and our Department of General Services. And we pulled actually National Guard administrative staff on board to help us vet those companies, because we wanted to use Tennessee-based or United States-based companies. And we actually were able to find some, though the lots were small, they were able to help us out, and we were able to take that time to look into them a little bit more clearly.
Great, thanks, Melissa. Bonnie, how about you? Do you have to vet new vendors? I know you said you had some local companies maybe that were pitching in, but as you did outreach to other states, or just what was your experience of vetting new vendors?
It was difficult. Most of these vendors are not here in Hawaii, so we didn't have any kind of background information on them. But we developed a system, or at least the staff did, to check them out. We checked all kinds of resources. Dun and Bradstreet. We checked chambers of commerce. We checked other states' contracts, or checked with other states. Do you have a contract with them? So we had to go through that whole process to see if these guys were real or not.
Yeah. Dirk, you requested samples, which I loved. You're like, hey, we're not going to work with you unless we can actually see the physical product. Anything else that you did to ensure that you were going to get the quality, selection, quantity, delivery speeds that you required?
To be honest with you, early and often, some of it was just based off relationships. If someone's done it on the phone, okay, and then the sample turned out, then that was, very early on. After that, we took a little bit more time and started doing investigations into the company. And quite frankly, we just didn't take the risk of turning to someone that looked like a venture capitalist that pivoted from, being an aviation company to PPE. We just made the risk analysis and moved on. So that was just how we did it. Hopefully we never have to go through that again. And luckily, as vendors become back to normal, it's been okay. Honestly, the marketplace is a little bit expanded, and as new vendors such as Amazon that have unique and very easy customer service side of distributions, I just hope we can get out of the whole procurement game from the Department of Health standpoint for the whole supply chain. That's kind of the long-term strategy that we're looking at, is making sure that our customers, or who we're, I guess for lack of a better term, customers right now, are successful on their own. And that's really what we want to return to as soon as possible. And hopefully we don't have to continue to vet individuals or companies.
Yeah, exactly. Mark Howard, well, there are actually 3 names here: Mark, Howard, Alvarez, maybe 4 names, and Marcel. Maybe that's a family. It's a family affair here. But there's a question: what are the innovative practices? This is one of mine as well. So reinforces thought that I had here, which is, what are the innovative practices you think will continue and be expanded that you've learned from this pandemic experience? We'll go to you, Bonnie.
Okay, so we've always been part of the Hawaii Emergency Management Agency, and they have just probably like all the other states, a web EOC. But what we've done is, within our own group, is create our own lead and take advantage of that using all the tools available, technology tools available to us, Microsoft Teams and those good things, to make sure that we're all keeping in touch with whatever happens, and networking even more with other states and other organizations that could probably step in and help us, get over whatever needs that we currently have.
Okay, thanks, Bonnie. Melissa?
For Tennessee, one of the innovative pieces that will remain with us is 2 parts. One is the centralized collaboration for our state for purchasing. It is something unique that we have done individually before, but building the trust with our local government, county government, city governments, non-for-profits, even our medical community in some instances, that we're supporting together. The second part would be the innovative idea from our team, using specifically Survey 123 as our online ordering platform, has been fruitful. It has been collaborative. It has been efficient as we transition from an ordering to a pick list to an actual shipment plan. It is something that we are already looking to incorporate into our catastrophic logistics plan for other events that may come through Tennessee.
Great, thanks, Melissa. Dirk, what are the innovations that will endure?
Gosh, one of the innovations that didn't endure is we still do 213 requests for everything. And Melissa probably understands that. So every request we get for PPE still has a hard copy 213, which is really interesting. But in terms of long-term process, I really hope that we can move to an online ordering platform, and also kind of separating the middleman. We serve here as a middleman for a lot of the ordering requests and bringing it into the state. Again, what we want to transition to is getting from, really the state being the supply chain here, and moving it back into the private marketplace. So as hospitals go back online and hopefully their vendors return to normal, also provide them other opportunities. We've done this a number of times with different organizations, even state agencies, where we're bringing them into our own whitelisted accounts, such as through Amazon and through some other vendors, but also turning that out to the hospital associations, to the primary care associations, and trying to bring them into one account, or bringing them into the fold of, getting back into the private marketplace, so that there's not such a reliance on really the government to be that supply chain. And hopefully that's the long-term goal that we really want to get to.
Great, thanks, Dirk. Well, NASCA, we're at about 4:40. Do we have some extra time here, or should I be landing the plane?
Yeah, I think if you want to put a final bow on it, that would be perfect. And then what we were going to do is we were going to send everyone into breakout so we can really dive in and let people talk. So any kind of final bow on that, Andy and Ann, and we've learned so much from Hawaii, from Tennessee, from Wyoming. So Andy, big picture. Bring it home.
Well, I'm going to turn that over to Ann as our public sector leader. But first, let me say again, thank you, Bonnie, Melissa, and Dirk, for your time today. That was fascinating. I know we did some prep calls, and I learned a lot then, and I learned even more today. And I'm sure that all of your colleagues across the country did as well. So, Ann, I'm going to give you the last word.
Thanks, Andy,
thoughts?
and thanks. Yeah, thanks, Andy, and thanks to our panel. Yeah, it was interesting because at the beginning I had said, what I liked about this panel was we were going to get a 360 view because of the different functional areas. I hadn't quite appreciated also the 360 view because of the different regions and sort of the extraordinary challenges of Hawaii, for example, being an island. I think the common themes throughout that I heard around innovation that I think have some staying power are certainly around this idea of a unified command structure, which I know David Yerkins on our call today, he and I both worked in the state of Pennsylvania, and that was something that we worked towards having a sort of central procurement team. Certainly this notion of there are supply chain challenges end to end, and maybe thinking and turning towards non-traditional suppliers or channels for some of those solutions. I think the theme of public-private partnerships was underscored here, and we talked a lot about that when I was in government. But I think you're seeing that in an extraordinary way now in COVID. And as I said at the outset, like I see these partnerships being the discussions being much more strategic. And I hope certainly that's something that continues as well. So thank you again to our panel and to my colleague Andy, and of course to NASCA and all the participants today.